This is a video by Simon Eglinton, a UniSA exercise physiology student. I will be explaining the benefits of exercise for the treatment of osteoporosis. Exercise can be used alongside other treatments to increase bone density in people with osteoporosis and reduce a person's risk of falls. There are no specific exercises to do as long as the bones are loaded correctly to increase bone density, as well as various balance and strength exercises that can be done to prevent a fall. Increased confidence in everyday activities is also a major benefit, as many sufferers of osteoporosis are afraid of having a fall with extreme consequences. People with osteoporosis may not know what to do in terms of exercise to help their condition, so guidance is often needed to be advised on precautions on how to track their progress. Motivation and educating someone on the benefits of exercise are a large part in changing someone's behavior to adhere to an exercise program. Exercise has been shown to increase bone mineral density in many different studies. The increases are not enormous but still significant. With age, there is a decline in bone density due to osteoclast activity outweighing osteoblast activity. Exercise has been shown to slow this natural decline by applying stress to the bones, which increases osteoblast activity. Various studies have shown increases in bone mineral density due to exercise intervention. This increase in bone density occurs only in the bones that are loaded, so full body exercise is recommended. The main risk to people with osteoporosis is falling, which can result in a bone fracture. If strength and balance are increased, it has been shown to reduce the risk of having a fall. Through appropriate exercise prescription, these can be developed in a safe way. A study by Thompson et al. Showed a significant decrease in falls risk from 2 60-minute sessions a week in adults who had a history of falls. Increasing strength and balance can also improve a person's confidence to do various daily tasks which could be considered dangerous by the person otherwise. Many people with osteoporosis have a great fear of falls due to stories of people having fractures and having lifelong health issues afterwards. This can result in people not being involved with activities of daily living, which results in more reliance on family or care workers and a lower quality of life. For ideal bone density increase, high-impact activities such as running and jumping are great, although such stress on the bones of a person with osteoporosis may cause a fracture. Lower-impact activities such as brisk walking are much safer for a person with such a diagnosis. Exercises which put the spine into excessive flexion, such as sit-ups and bending over without a neutral spine, must be avoided, as the pressure on the vertebral column can cause a fracture. Any pain a client may be feeling related to the bones or joints should be evaluated by a doctor before any exercise is continued. A DEXA scan is used initially to determine a diagnosis of osteoporosis, which uses X-ray to determine bone density. This is usually only done for diagnosis, and any follow-up check would be done years later, as it is costly and won't track small changes very well. In order to see if a treatment is working, whether it's medication or exercise, blood and urine tests can be used to track small progress. Biochemical bone markers are detected to find whether the rate of bone turnover is leading to an overall bone production or loss. These are fairly easy to do, as well as being able to see small progress over time. When prescribing an exercise program, frequency is ideally up to 3 to 4 times a week, although this may have to be varied depending on other pathology that the client might have and how much the client is motivated to do. Intensity should aim to tire the client for strength-based exercises after 10 repetitions, but not to exhaustion. 2 to 3 sets of 8 to 10 repetitions is ideal, with as many different exercises that the client is able to do during a session. The type of exercises should aim to load the muscles of the upper and lower trunk in addition to the wrist, spine and hips, as these are common areas to fracture in a fall. Balance exercises are also highly beneficial to reduce the risk of falls, as much impact should be applied as possible without fracture. Exercises such as running and jumping will have the best osteogenic effect, although can be quite dangerous depending on the client. Aerobic exercises are good for overall health, but do very little for increasing bone density. Balance and overall strength exercises such as movements on an unstable surface like a Bosu ball are great for falls prevention. Exercise can have improvements in bone density and falls prevention if a client is properly assessed and an exercise program is adhered to. High impact exercises such as skipping will have the greatest improvement in bone density, while balance exercises will help with falls prevention. Precaution must be taken to reduce the risk of fracture while exercising. In terms of practical applications, one-on-one sessions are most probably needed to educate the client on how exercise can benefit their condition and the correct way to use exercise to treat it. Group classes could then be used as a social setting, could be beneficial to adherence. Encouragement and motivation are essential for someone to improve their condition, as this could be the main hurdle for someone who hasn't exercised before and doesn't particularly enjoy it.